During the treatment, I had no end of tablets. Certainly when I was in the hospital, I remember 9 little cups with tablets in on my little table across the bed. The worst of those, I think, for me was the painkiller. I was on morphine for quite a long time, and the radiotherapy, I think, was making me sick, and I think the morphine was adding to that. Didn't get on too well with morphine, and you had to come off of that gradually. So I had liquid morphine that I'd be taking when things would get just too much.
More or less every morning, afternoon, and evening, they used to give me something like about 5 or 6 different medicine mixed together in a little cup and feed me through the syringe. They did it. And then they had to put one of the containers, the hanging container, which used to go for the whole night.
Medications, and you've got to keep on top of them. If you don't, it's easy to forget them when you're being treated, which is another value of having somebody looking after you. I think you can get so sort of run down with it all, you just lay there and not take anything, and then you'd feel worse.
It was with great trepidation that I administered drugs. I had a list. Every time I came to the outpatients, the girls would tell me what I had to do, give me the drugs I had to administer, etc., and wait for hours in the pharmacy for them. So I made notes, and I kept notes so that I knew this 3 times a day, this when needed.
You'd go to the clinic, and then you'd have to go to the pharmacy in the hospital, and you'd have to wait for ages. It would be a long wait because they were incredibly busy. So sometimes we'd go off and have something to eat after we'd put the prescription in. We'd go off and have something to eat, or you would have something to eat. I'd sit and watch, and wander around the hospital grounds. So you'd go up, you'd get your radiotherapy, you'd then go and wait in clinic for a little while. You'd see the consultant, you'd see the dietitian, you'd see the speech therapist, you'd have your prescription, you'd go out to the pharmacy. It was a whole day.
Each week, patients would see us, we'd look at the medications that they were on, see what medications need to be changed and what needs to be re-prescribed. It's ideal if patients can keep an eye on the medications that they're taking, keep a diary of what they're using, and let us know when they're running out as well, so that they don't run out and we can prescribe appropriately. And also just to make sure that during their treatment, that if they have smoked or drunk prior to their treatment starting, that they don't smoke or drink during the radiotherapy, because that may make their side effects much worse. It's much more likely to bring them into hospital and give them longer term problems following the completion of their treatment.